So I'm a dentist practicing in Ontario right now, around Toronto area. I did my high school here in Mississauga in Ontario, and then I went to McMaster University for my undergrad. I did life sciences for 4 years, and then I was actually leaning more into medicine. So I did my MCAT. I did not like that. The test wasn't for me. And then I also shadowed both a doctor and a dentist, but I didn't see myself doing family medicine. I just felt like you do the same thing over and over, you prescribe. I didn't see any satisfaction with that. But when I saw shadowing a dentist, I saw that you can actually get satisfaction out of it. You're working with your hands. It's a combination of art, medicine. It's kind of everything that I really wanted to do. So I started studying for my DAT, did my DAT here in Canada, the Canadian one, and then applied to Canadian schools. I was very confident that I would get in a Canadian school. I was very close. I got my interview at Western, and I was super happy with my interview, but they had around 370 interviews, something like that, and they accepted 56 students. So it was very, very low chances. So at that time, I was very sad that I didn't get in. But then I applied to Australia. At that time, my boyfriend was doing dentistry in Melbourne University. So that's the only school I applied to. I put all my eggs in one basket kind of thing, didn't apply anywhere else, and then got into Melbourne University. And that was the best choice I've ever done. Um, After I went to school there, I was very happy that I didn't get into Western. And because that changed my life, it was a whole different experience, not just school-wise, but also a different life experience in terms of experiencing Australia, traveling, making friends. It was just a great experience overall. I graduated 2021, came back here during COVID. So during COVID, there was a lot of different things going on in school. We missed a lot of clinic and stuff like that. If you have any questions about that, we can also talk about it after. So came back after COVID, things were getting better. And then I started working in 3 different clinics. They were completely different practices. One of them was taking a lot more government patients, which was a bit more or less pay, but you see a lot more experience. One of them was my aunt's clinic, which I did 1 day there. And then a third clinic, it was a bit of a drive, but it was a really good experience. I left one of them and now currently working in 2 clinics, and it's been great for the past 2 years.
So how difficult did you find it coming back to Canada, or being right out of dental school to find a job? Did you find it was oversaturated, or did you find you found work relatively easily?
I didn't find it very hard. There's a lot of places that you can go to. There is a lot of dentists. Every plaza has a dentist or two. So walking in, talking to the dentist, getting to know them, some of them might be applying. Other places are like the UFT website has a lot. Every day they post different ads on there, so you can easily email and get on that as well. There's also other area. So we get a lot of emails from ODA and stuff like that, where you can also get jobs and apply through that as well. Or if you know people in dentistry, that really helps as well, getting to know for different people and applying through that. So I didn't find it very hard finding the 3 jobs that I started with. And I don't think it would be when all of you graduate as well.
Dr. Bruce?
Yeah, I think there's really if there's so many offices out there, it's not going to be hard to find a job, but it is difficult to find the job that fits you. You really don't want to just take any job because some jobs will burn you out right away. Some jobs in the mall, for example, they book you like you're in a factory. Some jobs, you'll make lots of money. You're gonna get burnt out pretty quick. So I think it's not a matter of a job, but whether you can find the job that fits you.
And Dr. Coco, did you have any indication that you might want to stay in Australia? Did you know anybody that stayed back to practice there, and kind of how are they doing? Is it kind of the same, or they would work in multiple clinics and things like that, or do you have any insight into that?
That's the biggest question I get. Even my patients here, they're like, "What are you doing? Why are you in Canada right now?" It was a great experience there. Australia is a beautiful country. It is very similar to Canada, but the weather makes it a lot better. And I find it less stressful than Canada. In terms of work, people are a bit more relaxed. So yeah, a lot of us thought about it. My class was 30% Canadian, and most of us thought about staying in Canada. For me, I'm just a big baby. I love my family. I'm a big family person, so that's the big reason I came back. My husband, well, at the time was my boyfriend. He also came back. He graduated 2 years before me, came back. So we got married right after I came back. So it was a lot of family things that I wanted to come back for. But I definitely thought about it. So a lot of my friends did stay. Pay in Australia is not that bad, but they treat new grads a bit different than when you're kind of an experienced dentist. First year or two, you're on salary, so it's a lot different. You make a bit less money, but they mentor you a lot. So a lot of my friends are getting that mentorship, which is really helpful as well. So yeah, staying back is not a bad idea. You still make good money there as well.